All right, we're live.
Okay. Hello, everyone. Welcome to Target Center's Experience Ability. Today, we're going to be discussing Older Americans Month. We have Patrice Ernest. She's the Elder Care Director, and she's going to be giving us some great resources.
Thank you. Good morning, everyone.
Morning.
Thank you so much for joining our conversation today and being a part of the celebration of Older Americans Month. I am Patrice Ernest, and I am the project director of the Eldercare Locator. And we're going to talk a little bit about the Eldercare Locator, and I hope everyone who's listening in will also make sure that by the end of this presentation that everyone knows how the Eldercare Locator can be a very valuable resource for you. This is a great month to celebrate Older Americans Month, and every year Older Americans Month has a theme, and this year the theme is Blaze a Trail. And I like that theme especially because as we're going to be talking about community resources. So in this time that we have today, we're going to talk about blazing a trail to access community resources. Older Americans Month really is the time to provide tools to help you blaze new trails as you age, and the theme is actually set through the Administration on Aging, which is a part of the Administration of Community Living, a part of Health and Human Services. We're going to talk today about a wide range of topics, from volunteerism to some of the home and community resources that individuals depend upon. But I first want to give you a little bit of information about the Area Agencies on Aging and the organization that I represent. I come from the National Association of Area Agencies on Aging. We represent over 600 area agencies on aging in the United States, and also the Title VI Native American Aging programs. So again, we're going to learn a little bit about those programs and how they are a central source of access to services. Let's look for a minute at what I think is a very interesting demographic. I just want to share a little bit of background, as you can see, about what is happening in our nation. And according to data from the profile of older Americans, you can see the growth there. You can see that that those age 65 and over, most recently is over 40,000 individuals, and this actually comes from from the U.S. Census data. So what does this look like? Look like a wave of population of our older adults growing older, and throughout the adults, I said, we've got to prepare, because the wave is coming. The wave is here. So as you can see here, that in less than 15 years, we have 1 in 5 Americans are going to had in 2000, we had about 10% of the population age 65 and over. That's a doubling in 30 years. So that's a lot of impact that it has on accessing services and programs for older adults. I really like this slide, and I just want to spend a few minutes talking about caregiving, because as you can see, it says one person caring about another's represents life's greatest value. And as we grow older, there's going to be more caregivers. And I see us shaking our heads. Yes, many of us may be caregivers or have been a caregiver. Just in general, a caregiver is anybody who provides help to another person in need. We have formal caregivers, we have informal caregivers, and in our nation, the estimates, as best as we can see, are over 43 million caregivers today. There's a recent study that is available, an interesting study, Caregiving in the U.S., 2015. It was conducted in partnership with the National Alliance for Caregiving and AARP. And one of the things that it points out is just the diversity in caregiving. Caregivers come from every age, every gender, socioeconomic, racial, and ethnic groups. They share positive aspects, and they also share challenges, as you can guess. And when you think about, again, back to that wave of older adults, some of the challenges are many caregivers who are older themselves and have the challenges that they have and that they face, and they're also caregivers as well. In time of caregiving can be very challenging. I sometimes have to just take off my professional hat and as a former caregiver and a current caregiver. I know that this is so important because there are challenges and what I consider poignancy too, because I know you may have heard a lot about the sandwich generation, but I can remember one of the things that I hope that I've instilled with my daughter is how caregiving is a part of life. And when my mother was with us and my daughter was 7 years old, we spent one summer trying to find the best milkshake in Atlanta, Georgia. and I hope that I hope that that's a memory that she can take with her, because it certainly is one of the memories that right now that I share. So caregiving, again, is something that is huge in that we have. I want to switch over to, we talked about the demographics. We talked about the challenges with caregiving. I want to talk a little bit about the structure of our nation's National Aging Network. And this is kind of a formal slide about how legislation is in place to help with programs and services. And I'm going to go back in time to the 1965 Older Americans Act, which was passed. And that act really put in place a whole spectrum of services and programs that we're going to spend a little bit of time talking about. And then we're going to talk about how you can access some of the programs and services. So we talked about the 1965 Older Americans Act that set up a whole structure through the Department of Health and Human Services, the Administration on Aging, and as I mentioned, it's a part of the Administration for Community Living now. Through that act, state units on aging were developed. And then through those state units on aging, every state can designate an area agency on aging. And remember how I said I am with the organization, the National Association of Area Agencies on Aging, that represents those area agencies on aging. By law, the area agencies on aging cannot do direct services, but we can plan, implement, and put in place a whole service delivery system for those services. So right there you see the direct service providers that are in place to actually provide those services. This actually kind of shows you another example of how through the federal government and the states, what we call the state units on aging, and how there are 623 area agencies on aging nationwide. It also includes our territories as well too. And then again, down to those local service providers. Area agencies on aging can vary in the states. The state of Georgia, for instance, has 12 area agencies on aging. Some states have many more. Some states only have one area agency on aging. So you can see here that we have a wide range of area agencies on aging when you think of all of those organizations that have been developed. This is just a little bit, again, a background about what area agencies on aging do to play a key role, because if anyone is interested in advocacy, area agencies on aging is also a great place to advocate for programs and services for older adults and persons with disabilities as well. Planning, developing, coordinating, delivering. That's our services that we really work to put in place. Here's an example of some of the services, and I really want to talk about these services so that people can, again, know that there may be some services that are in place in local communities. I do have to stress that, remember we just saw that big map of the United States, and services can vary from state to state, from county to county, or even locally, because other funds may come in to support some of those programs and services as well, in addition to those funds coming through that Older Americans Act. I put information and referral first because that is really the gateway to figuring out what services are in place in local communities, what services exist. Information and referral is a trusted program that individuals can go to get reliable, unbiased information on services. We're going to talk about what some of those calls that we get into our Eldercare Locator involve too. Other services that the Area Agencies on Aging help to coordinate include, many of us may know about the Meals on Wheels programs, nutritional programs also that may be within senior centers in local communities. Senior centers also have a wide variety of activities and programs. Usually they're from about maybe 9 or 10 o'clock in the morning till a little bit after the lunchtime hour. Although some centers, and we're going to talk about some of the expanded senior centers that also have wellness programs and after hours type of programs. Transportation services, that's probably one of our greatest needs. Many of the Area Agencies on Aging coordinate transportation services for individuals who may need to go to medical appointments and other transportation services. I want to spend a few minutes talking to you about adult daycare and in-home services. And those services are really for someone who needs in-home supportive care, or maybe the care, what we call for the caregiver respite, meaning that there's a little bit of time that someone that you're caring for may be able to go to an adult daycare program while the caregiver gets a little bit of chance to rest or to do something that they feel like is just a little bit of respite. These programs are often provided by providers. Something that is very important as you look at in-home services and adult daycare services and those providers, as someone may give you information about a provider, is to check out and see if that provider in that local area is subject to any licensure. Very important. In the state of Georgia, for instance, home care providers have to be licensed by the state. And once you find that out, find out if there is also that regulatory agency, if you may be able to look at any inspection reports or monitoring reports of those providers. Care management is another service, again through the Area Agencies on Aging, and a care manager will help to meet with an older adult family member, develop a plan that might look at what that individual is looking for. We have what we call person-centered services now. So what's important to the individual, and setting up a care plan and helping to monitor their programs and services, and working with them to see that those services are meeting their needs. Legal services. This is an important program that many Area Agencies on Aging work with. They may be through a legal aid program. In some cases, legal services work with the Ombudsman program. And I want to spend a few minutes talking about the long-term care Ombudsman program, because the Ombudsmen are really advocates for those who are who may be in assisted living or nursing homes. Ombudsman, that's a funny word, isn't it? It's kind of like ombudsman. It's actually a Swedish word. It really means to advocate on the behalf of. and to advocate for someone. So in many cases, the ombudsman is that advocate looking at the rights of the resident, looking to make sure that the residents' rights are protected. And they do so in a confidential manner. And again, it's a very important program if someone is having care in a nursing facility or an assisted living facility, to know who that ombudsman is. And of course, I have to talk about volunteer programs because so often the volunteer programs, volunteers are the heart and soul of so many programs that get the job done. Because so often public entities can't do all the work ourselves, neither can some private. We all work together. But one of the things that really work to get the programs and services are the volunteers that make things happen. So as a former volunteer coordinator, I have to put in a plug for if anyone is ever interested in volunteering with the Meals on Wheels programs or senior centers or some of the services that you see here, please don't hesitate to contact your local area agency on aging because it can be life enriching. Are there any questions about the services that we touched upon here? No questions? So that's a lot of information just about those types of services. And so often it's like, how do you find out about these services? Where do you go? We also have health and wellness programs, and a lot of our area agencies on aging and other service providers are really emphasizing health and wellness centers. So going beyond just a very small, short part of the day and looking at programs that really are enriching to older adults and persons with disabilities. It may include having computer programs in some of the centers. A lot of aerobic. We have one center that I'm aware of that does water aerobics. A lot of programs that involve even field trips and activity trips. A lot of just fun and wellness type of programs. And a lot of the centers will partner sometimes with other health organizations to offer those programs. So again, I encourage people to find out if you have a local wellness center, because we're really looking at prevention when we look at some of the wellness centers. And of course, I mentioned about volunteering. And again, volunteering with outreach, sometimes helping to get the information out, where people can go for help, again, is so important. I want to talk a little bit about building communities for all ages, because again, we have Older Americans Month and it's Blaze a Trail, and this is a new sort of new emphasis that's going on nationwide in looking at communities that are really accessible for persons of all ages, looking at safe walkways, for an example, looking at affordable housing. Looking at how do you look at access to services, but it's also just places where persons of all ages can have those safe mobility plans, affordable housing services, and available health and wellness programs. It's bringing together a lot of partners in this to really look at where can we really look at these programs that will make a difference in having communities that are safe and healthy for all ages. One example I know is that many communities are looking at farmers markets and bringing in farmers markets for nutritional purposes and looking at healthy gardening as an example too. Just some really exciting things going on in terms of building lifelong communities. So. Want to switch over now because again the whole theme here, we've talked about all of these services and programs, and we've talked about like the transportation being one of the big needs. We talked about access to services. How do you find out about all these services? Well, that's where I come into place here. I want to talk to you a little bit about the Eldercare Locator. And for those of us in our class today, we have a brochure, and certainly I'll be glad to give you the website that you can access this brochure. But the Eldercare Locator is our first step to finding services nationwide. For someone who may be a caregiver in Flint, Michigan, but their parent is in Florida, they're a long distance caregiver. How do you find out about some of those resources and services? How do you find out about if you have a friend who lives in California and needs to access some of the things that we just talked about? Well, the Eldercare Locator is funded through the Administration on Aging. We are going to be celebrating our 25th year in providing information and referral services. So the Eldercare Locator, individuals can call us from 9 a.m. to 8 p.m. Eastern Standard Time, and they can speak to a information and referral specialist who can guide them to the location for all of those area agencies on aging or other agencies that we may need to link someone to. It's a toll-free number. We have on staff 15 outstanding colleagues, and I'm new to this position in the last year, and they have enriched my life just with their knowledge and information and their concern and dedication. They never know what that next call is going to be. We do get calls from persons who have reported abuse, and one of those calls is one call too many. But the Eldercare Locator will direct that individual to the appropriate resource in those cases.
Ooh, I can't even imagine.
I
have a question.
Yes.
Is your locator, will it help people specifically, like if they have an elder? Do they have programs just for dementia, or?
Now, if someone is go ahead.
A lot of the programs that they have, you can't include,
Right.
People with dementia in those programs. It's mainly for people that are just older and, they're okay, but.
What happens often, and again, speaking from a caregiver perspective as well too, is when one would call the Eldercare Locator, we'd get a little bit of information. We don't get a lot because we don't want someone to have to repeat their call again. And if it was someone maybe concerned about their parent with dementia, one of the things we would want to do is refer them to the local area agency on aging and possibly other organizations, depending perhaps on the information that the caller has given us. If the individual perhaps has Alzheimer's, we want to make sure that they're connected with the Alzheimer's Association so that they know about some of the programs that organization may offer. But we also want to connect them to, and I'll just give an example. If someone called from the state that I just came from, Georgia, we would also want to make sure that they knew about their state chapter of their area, of their Alzheimer's Association, but also their area agency on aging, because they may need an assessment to see what they might be eligible for. They also may need to know about some of the other programs that are in existence. For example, if the person has called and they're concerned about their loved one because they wander, they need to know the area agency on aging will give them information about some of the programs, maybe about a medical alert type of device that someone can use. They may need to know about programs like Project Lifesaver, which is a program that is in some communities. If they called from Georgia and they're concerned about wandering, and I have to put in a plug for this. The state of Georgia has a program, and other states have similar programs called, the state of Georgia is called Maddie's Call. And it's a program that if someone wanders away and they are at risk for not returning, then when someone calls 911, they should ask, can you implement a Maddie's Call? Or other states have different names for that. They need to find out if that's available in their state, because that puts in an important process for that person who has wandered. There may be other services. Perhaps they're looking at in-home care. And so again, by calling that area agency on aging, they will do an assessment to see what they're eligible for. Okay. One of the challenges, and I've got to say this because it is such a challenge, is that for so many programs and services, there may be waiting lists, especially if we're talking about someone on a limited income that needs services to remain in their own home. So unfortunately, for many states and many areas, there's a waiting list. But I do encourage people to call too, because there may be some other programs that they're just not aware of, that they may not know about. So thank you. That was a good question. A long answer.
Okay, it was a good answer.
But I think one of the things is also when you call, and again, when you're calling our Eldercare Locator, I mentioned our calls are very short. Our calls are very short because we want to get you to the right place, to get to the place that's going to provide unbiased, reliable, accurate information. So, but let me show you how many calls that we get into the Eldercare Locator. This is last year. This is 2015. So people do know about us. But we received 280,000 calls. And I have to share that the majority of those calls, because we always ask, how did you hear about us, actually came from the public sector. That includes people who may have heard about us from Social Security or Medicare. They may have received a letter, and it had our number at the bottom for the Eldercare Locator. So I'm hoping that this is a chance for those of you within the USDA to know who we are too and get the word out about the Eldercare Locator. Our calls are Monday through Friday from 9 a.m. to 8 p.m. Eastern Standard Time. Just a little bit to also, I'm going to share with you, we have a website. And on that website, individuals can email, and they can also chat too. The chat is also available from 9 a.m. to 8 p.m. Or individuals can send us emails as well. Any questions about the service itself? No? Wanted to share again a little bit of information about the top purposes of the calls. And you can see again here, transportation, getting to the doctor. There's something that we call door-to-door and door-through-door transportation, because sometimes it's not just getting to that appointment, it's getting into that office or getting around that campus. So there's a lot of what we call secondary needs that go into transportation as well. But also regarding transportation, there's a lot of people who call us about their concerns about driver safety, older driver safety programs. And I gave you all a brochure. Again, this is available on our website too, for caregivers who might be concerned about a family member who is still driving. And this is a very helpful piece, because I think it provides some very valuable resources. It addresses the issue if someone is looking at their driver skills changing and what some of those issues might be. It talks about also about how can you be a better driver. What are some of the tips It references a couple of the associations that work to have driver safety programs, or in one case, for instance, like the Car Fit program that's available. And then it also addresses some of the transportation options. We also include in this a transportation needs checklist. And again, this is available online. So I hope that this is a good piece. It's a very sensitive issue when it comes to older drivers. One of the things it also mentions is how does one become comfortable with learning public transportation. And there are some very good programs out there that can help someone learn who has maybe never used public transit before. I know one program, some of them have kind of catchy names. One I know is called Get on the Bus, Gus. But again, it may be helpful for people that are looking at some of the transportation options. So transportation is number one for us. Followed by, and increasingly, the housing options. Individuals call us about affordable housing, which is, again, another big challenge. In addition to affordable housing, they may call about assisted living facilities. And again, one of the challenges that we have nationwide is the states sometimes have different names for those different programs. So referring them to your local area agency on aging is so important. In-home services. That could include someone to come in and stay with someone for a short period of time. Remember, we talked about respite services, so that could include the respite services. Medical assistance includes about a fourth of those calls are for affordable dental services. You know, where does someone go to find affordable dental services? And then you can see the health insurance programs. There's a word up there called SHIP. Does anybody know what SHIP stands for? Sometimes we talk in acronyms too much, but SHIP stands for the State Health Insurance Program. And that's a very good resource for individuals who sometimes just need to understand the complexities of Medicare and Medicaid and the prescription assistance programs. Every state has a state health insurance program. And again, by calling the Eldercare Locator, we can actually connect you to your state's state health insurance program. They do not recommend or endorse any particular provider or service, but they do an outstanding job of seeing what someone may be eligible for, and also connecting them with the programs that might be helpful. So great service. One of the things that happens so often with caregivers, and this is something that is a big concern, especially when individuals may have a relative that they're moving from another state, is the difference between Medicare and Medicaid. Medicare being the federal health insurance under Social Security for those age 65 and over, and those who are disabled that meet the qualifications for Medicare, and some other qualifications. The Medicaid, however, is administered by the states, and that's something that many of those who call our Eldercare Locator are unaware of, because what someone might be eligible for in one state under Medicaid, they may not be eligible for it in another state. And unfortunately, what I've seen happen often is because they did not know that, maybe they've moved their relative from the state where they had the services, and after that move took place, they find out that there's a waiting list under Medicaid for services. So again, planning, especially if it's a caregiver situation, planning is so important. And finding out, I go back to that Eldercare Locator number to find out, who is the contact in your community that can tell you about those types of services is very important. And then again, we get a lot of calls from individuals who have questions about Social Security or questions about Medicare. And in many cases, those questions can only be answered by those entities under Social Security or Centers for Medicare and Medicaid Services. So, but that's a lot of calls, isn't it? It is. It's a lot of calls that we get. Want to talk to you a little bit. We talked about the roadmap for transportation guide, but I want to share with you also about a couple other pieces of publications that we have that, again, are available online. We have some hard copies available too. These are our most popular. We have about 17 different topic areas with the Eldercare Locator that we have. You have the first one that I gave you was our pretty much our overall view of what the Eldercare Locator is, with our toll-free number as well as our website. And then we talked about the transportation brochure. We also have one on preventing falls at home. Again, prevention is so important. And then one that addresses brain health, active healthy wellness brochure. I want to spend a few minutes talking to you about, again, I'm all about the resources, so hopefully we can be able to talk a little bit about this brochure here, and I'll hold it up because I really think it's hot off the press. So it's maybe about a week old, I think, but we are already in our second printing of this because, again, so many people are just not aware of what some of the services and programs that are out there. And this is a brochure called Guide to Benefits for Seniors. And on the very first page, you have the Eldercare Locator. And again, our website and our toll-free number that you can call. Below, there is a program called Benefits Checkup, and that is through the National Council on Aging. And it's a great website for someone that just needs to know and access online, what types of programs and benefits someone might be eligible for. It will walk you through that process. We talked a little bit about the Medicaid program. And again, this document helps you get a little more information about some of those programs and services. Medicare Savings Program is really an important program, again, for persons who may have a limited income to know about, especially as it relates to prescription assistance. And also some of the programs under Medicare Savings that will help pay for your premiums, deductibles, and co-insurance under Medicare. So with the Medicare Savings Programs, you have to apply for those programs. So again, your area agencies on aging can help you with linking to that health insurance counseling program, that SHIP program for that. Prescription assistance, that's another program. And again, this document will give you information about where you can go to find out and learn more about those programs. In addition, there's some information about some of the programs offered through your organization, USDA. So we have information about SNAP. We have information about the Senior Farmers Market and the nutrition programs there. I see some smiles, that's cool. Thank you all for doing that. Thank you to USDA for these programs. Emergency food assistance programs and the commodity supplemental food programs that are offered through some of the programs there. So again, websites are available. This is a PDF on our website too that can be available. So if you have the ability to maybe put a link to some of these services, that would be great. Has anyone heard of the LIHEAP program? That's another acronym that we talk about sometimes, but LIHEAP stands for Low Income Heating and Energy Assistance Program. I think I got that right. But it is a program that helps to pay for one's energy cost. And again, it is a program that usually occurs in the early winter months, usually around October or November. Persons have to apply for it. but it will help pay directly to a utility company or a service provider assistance for some heating cost. And if funds are available, sometimes it will help in the summer months with cooling cost. So there is a toll-free number that persons can call to link up to those programs too. Again, funding is limited for these programs, so keep that in mind as well. And then it also addresses some of the main numbers to call for information on housing. And then lastly, certainly I want to talk a little bit about some of the programs that are available for income, tax, and legal support. We talked about some of the legal aid programs that are out there, but also we want to make sure that individuals know that there is an older workers program that is the senior community service employment program that is out there for persons age 55 and over who meet the eligibility criteria. And then we've just finished with tax season, so there is every year the tax counseling for the elderly program that is out there as well. One thing, as we're talking about taxes, sometimes local municipalities, counties, or local areas may have homestead exemption taxes or different types of programs for persons who are older. So it's always important to find out in your local area if there are any type of exemption programs that are out there, or even utility discount programs as well too. So we covered a lot of information. There's actually even some more information in this booklet too. But again, I encourage you to take a look at it, and if you have any questions. This document also addresses programs for veterans. And again, it's so important to make those connections to see if those programs are available. It also addresses programs for Native Americans in here too, and some main contacts. So, this is the guide that we were just referencing, and I hope it's a helpful tool. And I would love to hear feedback from y'all. If you see something that, I would love to know more about this program too. So let us know. Let us know how, if it's helpful. We'd love to hear, if programs have been helpful, if information has been useful. This is our Facebook for the Eldercare Locator, and individuals can visit us on Facebook. Would love to have more friends on Facebook. We have several thousand on the Facebook friends, but we just have an ongoing update of information that is available on our Facebook page. So I'd love to have you visit us on Facebook. And then this is our telephone number. This is our toll-free number. It is 1-800-677-1116. And again, you can visit our website at Eldercare.gov. The Eldercare.gov website, just so that you're aware, persons going to that site can put in their zip code, or they can put in their location, and it will also give information about the local area agencies on aging if you want to call those numbers directly, and other resources in programs too that we have on there as well. We're a trusted, reliable site that hopefully makes a difference in the lives of others as you connect to services. So blazing a trail is what we hope to do this month, and making sure, one of the things, and I've worked in this field for over 30 years, and I still hear the phrase, I didn't know where to go, or I didn't know who to call. Or I think, as I say, in these days where we have what I call information overload sometimes, you have so much information that where do you go to know that something is reliable and trusted? And again, the Eldercare Locator can set you on that path, blazing that trail path to accessing services. So I hope this has been helpful. we talked a lot about the programs and services that are eligibility-based programs. But again, there are other programs out there, and area agencies on aging are those central sources that can help people link to other programs, whether it's eligibility-based programs, fee-for-service-based programs, and many other services that are out there too. So, are there any questions or anything that we have had? I hope this has been helpful.
There's a question from the online audience.
Okay.
They were wondering, they said that they looked in the brochures were $1
Oh,
for the online audience. Is there a way for us to get?
we do charge for mailing out the publications. So yes, there is a cost for mailing and handling that we have of $1 for the hard copy. But you can also, if that is an issue, you can also certainly download the PDF of the brochure.
And we have some extra here that we.
You sure do. Oh yeah, sure. I'll leave these here with you too. So be glad to do that. So,
Okay.
any other questions?
This is great, because you don't know what to know. You don't know.
That's right.
So this is
And the indicator, I think, would be
Yeah.
good. I mean, I knew some of that information.
Uh-huh.
But, like I said, I have a relative that's having housing issues.
Mm-hmm.
She is low income,
Mm-hmm.
but she lives in Maryland, and she did call quite a few people, but she's not getting, she's actually homeless.
Mhm.
She's living in a hotel,
Mm.
and they pay, I don't know if she paid daily or weekly, but she said it's steady going up. They know
Mhm.
she's homeless.
Mm.
So when she called Maryland,
And she's elderly?
no, she's not elderly, but she does have, some health issues. And then she has her grandson, so it's kind of,
Mm.
Goodness.
so they gave her a listing, but they telling her it's gonna take like 30 days, but money is steady getting scarce, so.
You raised a couple areas that area agencies on aging are many of them are working with. One is grandparents who are raising grandchildren.
Okay.
And there has been, a trend in grandparents raising grandchildren too. So when you call your local area agency on aging, find out if there are programs for grandparents who are raising grandchildren. The other issue that you brought that is important for us to bring up before we close out here is that throughout the country, many of our area agencies on aging either have or work with what we call aging and disability resource centers. So that many of our programs, we talked primarily about programs for older adults today, but some of the programs that we addressed are also programs that are eligible, that persons who are under age 60 may be eligible for. Some of the programs we talked about have age eligibility eligibility limits. The older worker program, for instance, age 55 and over. But some of the programs that we've discussed, like the Medicaid waivered program, may be a program that someone who is under age 60 needs to make sure that they're looking at too. What we're trying to do in our field, and I think this is important, is that we're trying to break down the silos between aging and disability. Sometimes we talk about some of the same services, but we have different terminology for some of what we have the same services. We're talking about some of the things we talked about earlier about person-centered services. That's something that goes beyond age. It's something that persons of all ages. It's a person-centered, focused, and it boils down to making sure that the services are appropriate for an individual, regardless of age. So if you are looking for services for persons with disabilities, I do encourage you also to call the area agencies on aging and ask about the aging and disability resource centers in your community. So thank you for bringing that up. So, any other questions? Well, y'all have been great. Thank you. I hope this has been helpful, and thank you for helping to blaze a trail this year. Maybe next year I'll be invited back and we'll have a new theme, but it'll be about community resources for sure. Thank you.
Thank you.
Thank you.